One of the biggest barriers in hospice care is not always medical. Sometimes it's a misconception, and sometimes that misconception lives inside healthcare itself. So most of us were trained to cure, to fix the problem, but none of us weren't trained for what to do when curing is no longer the goal and comfort needs to become the focus. And because of that, hospice conversations often happen much later than they should. Hi, my name is Rupal. I am a registered nurse with experience in hospice and palliative care. Today's episode is a little different. I'm speaking directly to my healthcare colleagues, nurses, doctors, social workers, case managers. If you are a family member watching, please stay with me. This will help you understand why your healthcare team may be quiet about hospice even when they may already see your loved one declining. This isn't about blaming healthcare professionals. Most of us care deeply. I know because I have worked with them. But hospice and palliative care still carry a lot of stigma, and that stigma can delay conversations patients and families really need. Here's the truth. Most of us in healthcare are trained to treat, cure, and discharge. That's the foundation of our education, and it matters. But there isn't enough training on what to do when curative treatment stops working, on how to talk about comfort-focused care without it feeling like giving up on, or when to even start that conversation. So even when professionals know hospice exists, many hesitate, worried the patient will feel scared, the family will get upset, or that the word hospice itself will take away hope. But hospice isn't about taking away hope. It's about changing the focus when the illness isn't improving the way everyone hoped. Comfort, support, more help through a difficult stage, not less. A new way to live end of life. I have lived this, watched good clinicians stay quiet, not because they didn't care, but because no one ever taught them how to start this conversation. Today, I want my healthcare colleagues to pause and ask themselves 5 questions. When a patient's overall health isn't improving, when they are declining after every hospital visit, when treatments continue but the patient keeps getting weaker. Question 1. Is your patient comfortable right now, wherever they are? Not just medically stable, truly comfortable? We focus so much on labs, scans, that we simply forget to ask, is this person comfortable? Question 2. If your patient is in the hospital, will they stay comfortable at home? IV medications becomes oral. Stronger strength medication gets lower strength medication. And family suddenly has to watch symptoms themselves. Does the family have a clear plan? Or are we already expecting them back soon? Question 3. Are we seeing a pattern of repeated ER visits or admissions? This is a real patient and family, usually not coming back because they want to. If symptoms keep bringing them back, but the illness itself isn't being cured, that should make us pause and have the tough conversation about hospice. Question 4. Is the family burning out? Uncomfortable hospital chairs, cafeteria food, time off work, they're trying their best, often without enough help at home. The patient sees it, and many become emotionally tired because they don't want to be the reason their family is struggling. Question 5. Am I holding back because I am afraid of this conversation will upset someone? The fear is real, but avoiding the conversation doesn't protect the family. It often just delays the support they need. So many families later ask, why didn't anyone tell us this was an option sooner? I'm not making this up. I have lived through this so many times. It can take months before the hospice conversation starts, and by then, it's often too late. The patient most likely missed the window to be comfortable. They may never make it home to see the family, to eat something they love, to cuddle their pet one more time. The smell of that homemade food, the birds chirping in the front yard. These may sound like small things medically. To patients and families, they're not. They are the moments that matter the most. It's the feeling of being home and not at the hospital. Sometimes the decision gets made when the patient is unconscious or when only hours remain, and the family is forced to decide during the crisis they weren't prepared for. Hospice shouldn't only be a last-minute option. It should be discussed early enough for the patient and family to make a thoughtful decision. We feel this too. When a patient is admitted multiple times, you start to know them, their face, their spouse, their story. You can feel when things are changing. That's why advocacy matters. Asking the physician if it's time to discuss palliative care, asking social worker what support the family has at home, or simply opening the door so the family can ask questions. It doesn't have to start with the word hospice. Sometimes it's, what are you hoping for right now? What's changed since your last visit? Do you feel you have enough support at home? And when the time is right, there may be services that could help keep your loved one more comfortable. Would it be okay if we talked about those options? That short conversation can open the door. To families watching, if your loved one is getting weaker or going back to the hospital again and again, you don't have to wait for someone else to bring this up. You can ask, is it time to talk about comfort-focused care? Would palliative care or hospice help us? Asking doesn't mean you're giving up. It means you're trying to understand your options. Healthcare professionals, you have a powerful role here. We may not always have the perfect words, and the conversations may feel uncomfortable, but waiting too long can take away choices from the patient and family. So I urge my colleagues, advocate for your patients, ask the hard questions earlier, open the door before the window closes. In upcoming episodes, we will walk through real case scenarios, when and how to navigate these conversations. The goal isn't to take away hope. It's to give the patient comfort, dignity, support, and the chance to decide what they want while they still can. If this gives you something to think about, share it with a colleague. And if you're a family member wondering why no one brought this up sooner, there is more support at nurserupal.com. Link in the description below. Stay tuned for our next episode. See you then.